people are speaking out tonight about the federal government's plans to appeal a court decision to reverse funding cuts for refugee health care. A judge has given the federal government 4 months to restore funding. But as Eric Cito reports, the fight could drag on for quite some time.
Since 1957, anyone claiming refugee status in Canada was covered by our public health care system. It's a measure that many saw as a shining example of how our nation treats newcomers. But quietly, this past summer, the federal government clawed back that health care coverage, creating conditions some doctors liken to a third world country. We spent the past 2 months inside that world, seeing what it's like firsthand for both the refugees and the doctors who are now up in arms.
When she wonders how you can be so unfeeling as to turn a blind eye to her 4-year-old daughter's desperate battle with bacterial meningitis, or asks how exactly she is now supposed to help her daughter fight the crippling war that is raging through her spinal cord and her brain, ever since you decided to deny her refugee claim when she tells you that she never believed that in a country like Canada, her fear would become a mirror, one in which she is forced to repeatedly reflect and see herself living with the violent uncertainty she once faced.
Doctors in this country will not remain silent in the face of the conservative.
Well, I'll answer those questions after my announcement.
To the refugee health program.
I will be very happy to answer those questions after.
Of the most vulnerable members of our society, refugees who are coming from war-torn countries, fleeing hatred, fleeing crimes against humanity, and your government is about to cut the very essential medicines, the very essential services that these people require in order to continue living.
At midnight, most health care for refugees runs out. It's why this doctor is seeing a flood of refugee claimants today. They won't qualify tomorrow.
It's a shameful period of time. I think as Canadians we should be shamed by what's happening.
Because he has no status and landed in hospital with injuries, he's now $70,000 in debt with medical bills.
Driven from Somalia during civil war, Bashir Mohammed's family took refuge in Canada in 1994. With little more than the clothes on their back, his family leaned on the federal government for their medical needs.
If the government provided no support to us, then, my dad wouldn't be able to work, my mom wouldn't be able to breathe.
2 years ago, the federal government cut off health care for certain classes of refugees. And for 2 years, doctors and lawyers fought to overturn the changes.
Hospitals are now paying for the immigration minister's heartless decision to cut off health care for refugee claimants. Already overburdened Toronto hospitals are being forced to spend over $800,000 this year to cover the cost of emergency care for refugee claimants. Other refugees are being forced to pay for things like cancer treatment. Will the minister listen to hospitals, listen to the provinces, and have compassion for those less fortunate and reverse his reckless decision to cut refugee health care?
Good. The Honourable Minister of Citizenship and Immigration.
Mr. Speaker, I have listened to Canadians and I have not cut refugee health care. What we have done is to end gold-plated health benefits to false, rejected asylum claimants who have no legal right to be in Canada. And Mr. Speaker, it appears that,
lawyers are calling his house because of the debt.
A deportation plane ride is too dangerous. He needs surgery or physiotherapy to heal, neither of which will be covered now.
It says Canada's supposed to be a humanitarian country.
The new rules mean basic coverage only. It means a refugee claimant with asthma no longer gets a puffer, but will be treated for an asthma attack.
We all know that the extended wait times and the resources necessary for administering the emergency care will far outweigh the original cost of providing preventative health care services.
But just how despicable it is that people from war-torn countries would risk their lives, leave violent abuse behind, and travel thousands of miles to your country on nothing more than hope, only so that they may take unwarranted advantage of your thriving healthcare system. Explain to her that recent bills have been passed to combat this refugee problem, and that henceforth non-Canadians will never again receive healthcare that is in reality nothing more than what is provided to the lowest income Canadians on social assistance. Look her square in the face and tell her the truth.
The province of Quebec has already agreed to pay for what the federal government won't provide refugees. Ontario's health minister has told the feds she opposes the cuts.
Minister, do you have any comments about the cuts to refugee health care that are happening in this community? Do you have anything to say about the cuts? There's people here protesting.
At the newsroom.
Okay. Okay.
No cuts to refugee health. No cuts to refugee health. No cuts to
Minister Kenney. He's sick today? Okay.
That's my understanding.
Okay. He's sick? Minister Kenney's sick today, right?
Bashir Mohammed says he wanted to question Minister Jason Kenney about proposed changes to health care for refugees. He never got the chance. But as Nadia Stewart reports, the teen isn't giving up.
It wasn't what Immigration Minister Jason Kenney was expecting during his speech at a Conservative barbecue. The floor wasn't open for questions, but that didn't stop 17-year-old Bashir Mohammed. Mohammed wanted to question Kenney about proposed changes to refugee health care, changes that will strip refugee claimants of health benefits. So we bought a ticket to the event.
I didn't lie about getting in. I didn't sneak in.
Mohammed met the minister before the speech, but he says it was brief, no time for a question, so he lobbed one from the floor.
The most I could say is, Minister Kenney, my name is Bashir, and I'm a refugee. And then at that point, a guy in the blue shirt, the guy you saw in the video, came up and he started heckling me.
Mohammed was escorted out, but the minister was pressed on the refugee issue again, this time by someone who knows the system firsthand.
My question was simple. Please just meet with us. Put a hold on these cuts because we know we work firsthand with our refugee patients.
Their position seems to be that everyone who steps foot on Canadian soil, including visitors and illegal immigrants, should have comprehensive and even extended supplemental health benefits. We fundamentally disagree.
Toronto City Hall.
It's going to be a bit of a scene. Don't worry about it.
Security will come. They'll ask us to leave. Very politely, we'll leave, right?
It's an honor to welcome all of you to the 3-year countdown cultural.
Just as the federal sports minister takes to the podium for what's supposed to be a happy news story in the middle of summer.
To be here with you all today on behalf of Prime Minister Stephen Harper.
A handful of doctors move in to raise a little hell.
What about health care for refugees? Where would Daniel and Daly be without health care?
What are you doing to our patients, Mr. Gonzalez?
Why are you hurting our patients?
Refugees are athletes, too. Mr. Gonzalez, it's a shame.
Go back to Ottawa. All right.
Real doctors?
Yeah, we're real doctors. All real doctors. All federal government have cut health care for all refugees.
We've got a very ad hoc group we call Doctors for Refugee Care.
They are unlikely protesters, unaccustomed to yelling slogans, but hardly ad hoc.
Because we're tracking every move the Conservative government makes with its political announcements. And it'll be periodic and unpredictable interventions.
Head of family medicine at St. Mike's and master of the surprise attack, Dr. Philip Berger.
But you're a doctor, not a professional demonstrator.
Part of my job description to speak out, especially on behalf of people who are too terrified to speak out on their own behalf.
Across town on this summer's morning, a concrete parking lot behind a refugee shelter. North Korean children get their first taste of freedom. A wooden swing provides a moment's respite for a Congolese woman who's arrived alone from Africa. A makeshift clothesline, suitcases stuffed into a corner, the sole possessions of a Hungarian woman. These are the people with no voice. the 25,000 refugees who flee to Canada every year. Inside the shelter's health clinic, Dr. Meb Rashid faces his first wave of sick refugees under the new rules.
There's something very fundamental about kicking people when they're down, which I think most Canadians find offensive.
What this policy has done is reversed 50 years of Canada's historical ethical values of taking care of people who come from war-torn and violent situations and provide them minimal coverage equivalent to that of the poorest people in Canada, what they receive.
Who knows what conditions they've been exposed to in transit. They're arriving here, no health insurance.
So I'm Dr. Rashid, it's nice to meet you.
We can't get x-rays, we can't get laboratory testing, we can't get medications. It's catastrophic.
This week, a federal court judge called it unconstitutional. The judge saying in her 268-page decision, denying health care to newcomers was cruel and unusual.
When the government tells us that we need to be turning people away at the door or asking for people's papers to categorize them on a system that arbitrarily seems to grant or deny them health care, it is an absolute outrage.
The federal government has been given 4 months to restore funding. The fight far from over.
We'll be appealing this decision. Canadians understand the need for these reforms. They don't want to see abuse in their immigration program.
Critics say refusing upfront care ends up costing the health system more, and it's the provinces, not federal government, who end up footing the bill. Mohammed knows if not for that initial medical help after arriving to Canada, he wouldn't be where he is today.
It just goes to show that, you know, the health care that the government provided us put me in the position where I'm in now, where I'm a Canadian citizen, I'm contributing, I volunteer, you know, I contribute back to Canada. So it's just, you know, it's an investment.
Undaunted by the assistant's refusal to call the boss, Dr. Berger reads the new rules to a captive audience.
Puts out a document that says if people having heart attacks, it's not going to provide medical coverage for them, or insulin for diabetics.
Minutes later, police arrive.
Okay, doctors, you're going to have to go outside.
We advocate refugees.
And doctors spill outside.
Have you ever waved posters around and grabbed a bullhorn?
No. No, never.
So you're a rookie at these things?
Yes. Is this something I'm willing to go to jail for? Absolutely.
It means that if someone has angina, they're not going to get their nitroglycerin. It means if someone has out-of-control diabetes and may not be able to see a diabetes specialist. It means that someone can't walk anymore because they have such hip pain from arthritis, they're not going to get a hip replacement.
A taxpayer might say, why should I pay for that guy's hip replacement?
Refugees who are successful are going to become permanent residents and citizens. The longer one lets a condition go untreated, the more expensive the treatment's going to be later on anyway.